Vida started foaling around 10 p.m. and I went up, and she usually has a very textbook foaling. She's a great mom. She's easy to foal out. So I'm basically just here to make sure that the baby hits the milestones it needs to hit within the right amount of time. So you can see 2 feet coming out, and I've sped up the clip. It took about 2 to 3 minutes to come out. There comes the nose. And the sack is still over the baby's face. So in a minute here, when it comes out a little further, I'm going to break the sack open just so that when the baby comes out, he doesn't inhale any fluid. So he's not breathing yet because he didn't come all the way out and that umbilical cord didn't break yet. So I'm just clearing that out to get ahead of it. And you can see that one of the legs is back a little ways. So I just give her a few more minutes. You can see one of the legs is quite far out and one of them is back. And that's going to make it a little more difficult for her to push this baby out. So I'm giving her a couple minutes just to see if she can get it out on her own, and then I go to give her a hand, and I just pull that second leg forward just enough to unlock that shoulder, and then the baby slides out easily. And she probably could have done this on her own, but she was straining for a couple minutes, so I just wanted to help her, just make things go a little smoother for her. Baby's out. I'm clearing the airways a little bit, and one thing I like to do after I clear the airways is pull those hind legs away from mom so that when the baby starts flailing around, he doesn't accidentally kick her and damage her internally. So I just slide those back legs out and move them away from her. But be careful to keep that umbilical cord intact for as long as possible. The umbilical cord being intact can help the blood flow from the placenta into the foal so they can get a little extra blood. Drying the baby off just a little bit. It wasn't a terribly cold night, but I still like to help dry the baby off, especially since mom is resting. She's not getting up. So I'm going to help stimulate that baby a little bit, and that'll get him wanting to stand up and warm up and get some milk. And so it's really important in mares like this that lay down and stay down to break the sack over the baby's nose, because chances are this mare wouldn't have gotten up and that sack may not have broke, so the baby may have suffocated. Here you'll see the little foal slippers. Those are to protect the mare when the foal is on his way out, and as soon as he stands up, those will fall off. So I'm just giving mom and baby some time to relax. The umbilical cord is still attached. In this particular foal, the umbilical cord was quite thick, so rather than trying to let it break on its own, which can lead to umbilical hernias, I did cut the umbilical cord after about 10 minutes or so when the baby started trying to get up. And give mom some time to bond with the baby. I bring him a little closer to her head and I give her a pan of feed to replenish her energy. And you can see she's in no hurry to get up. She's quite content where she is. So mom finally gets up, and I just tied up the sack on the placenta so that she wouldn't be stepping on it, because you don't want them to accidentally tear it. So tying it in a knot creates a little bit of weight, and that helps it to come out naturally on its own and stay out of the way. The mare will usually lick or nip the baby to try to stimulate them to stand up. Here I'm just grabbing a little drop of colostrum to test it to see what the Brix reading is. And this is really important, because if the Brix reading on the colostrum is not over 20, then we would need to supplement that foal, or it could possibly need a plasma transfusion. So here he is trying to get up, and they will flop around and fall down and try again several times. Some are faster than others at getting up. So he wasn't too bad, and mom just stands by patiently and waits for him to get on his feet so he can get some milk. You can see here that he is hungry. He's looking for something to eat with his little mouth, but he can't quite figure out his legs yet. He almost had it this time, but not quite. And then finally he gets up on his legs and tries to find his balance. As soon as he's on his feet, he starts looking for milk, and the foals are basically hardwired to put their head where it's dark and there's pillars. So that might be the front legs or the back legs. They just keep trying with trial and error until they eventually accidentally bump into the milk. And then after that, they learn where that is. So here, while the baby's trying to figure that out, we're going to check the placenta over. So we just take it out after it comes out of the mare. I stick it in a bucket and then I lay it out on the floor. And I want to lay out the two horns, the pregnant horn and the non-pregnant horn, to check for any tears. And this is very important. If there were any tears, we may have to give the mare oxytocin to help her pass the rest of it, and we would watch very closely for any risk of infection. This placenta looks excellent. There were no tears or abnormalities. He's getting quite close to figuring out where the milk comes from. He's in the right location. He's just trying to figure out how to latch on. And he did this quite quickly, actually. And then when they do latch on, you want to make sure they're actually swallowing. So they could be pretending, trying to latch on, but not actually getting colostrum. And it's really important that they get it. He hit all his milestones within 3 hours, so he's off to the races.